Everyone wants to know about recovery. How long is it going to take? How much discomfort am I going to have? How long am I going to be out of circulation? Let's start with facelifts. Many patients are highly motivated to get back to their work, their social activities, and so the amount of recovery from a facelift is critical. I like to start out and say, what are your goals? What are you looking to be ready for? Is this something that has just been bothering you for a long time and now you've made the decision to address this? All of these decisions about why you were selecting this operation are extremely important to know so that I can help you plan the best recovery for you. So the first thing is going through the pre-op conversations with my entire team and getting ready for the operation ahead of time. Often this is meeting with my esthetician and getting primed in terms of your skin. We also work very closely with my surgical team, making sure that you have all of your medications ahead of time so that on surgery day, you feel comfortable and relaxed. Immediately after surgery, we use something called the hemostatic net, so we do not need to use any drains. We do a gentle wrap and allow you to either go home or stay in the stay suites, which are right down the hallway from us. We also have the option of going to a local hotel or going back to your home utilizing home care nursing, which is a phenomenal experience. I will have every patient come back 1 day post-op to check and ensure that you're moving down the healing process with no interruptions. Then what we do is we again just do a simple wrap. We allow patients to shower 1 day post-op. We've got very specific instructions on what kind of shampoo to use. We also apply a thin layer of antibiotic ointment around all the incisions as well as over top of the hemostatic net sutures. Generally by either post-op day 2, 3, or 4, depending on the circumstances, we have you back here to remove those hemostatic net sutures. And what that means is the sutures that are in your neck, and we jokingly call them that they look like puka shell necklaces. If you remember them when we were children, everybody wore the puka shell necklaces, and that's really what this looks like. The sutures are clear and you really can't see them, but you see tiny little puckering of the soft tissue. All these stitches come out at that time, and again, we put you back in a small, simple wrap. And the reason for that is that there may be a little bit of disruption as we're removing the sutures. We like to just give you another 12 hours of gentle compression to allow this to settle. Then again, after that, you're into daily showering. We have you slowly getting back to some more regular activities. Out walking is perfectly fine. We want you moving. We want you doing activity. And this is true for whether or not you have this done under general anesthesia or local tumescent anesthesia. It does not matter. Both of them the same recovery. Often we have the patients coming back at 5 to 7 days. A lot of the sutures, and sometimes we have little clips back behind your ear. These are all coming out such that most patients are ready to be out at the grocery store doing simple activities or even just walking about in the community. Sometimes if you've combined a blepharoplasty, we'd recommend sunglasses and maybe a scarf. You're able to be out in public doing some of your basic activities of daily living. As you come back, we're checking with you. You start working with my esthetician again. Some patients who are traveling from great distances can be headed back home at around 10 days. If you're local, we have you come back almost on a weekly basis to just check in. If you're going back home to a remote location, we have you checking in through a HIPAA-compliant portal where we're able to follow along with your recovery. Recommend that patients be ready for social activities going out. I say not your wedding, but a wedding by a month to 5 weeks after the procedure. And that is the optimal result. Some patients are ready for this much sooner. There are some times when maybe patients have had multiple other procedures at the same time. Their recovery may be a little bit longer. But we generally expect that people are out at social events by a month. Oftentimes the incisions can be easily hidden and disguised at that time by how your hair is being worn. This is actually an opportunity to start talking about some of the more exciting operations that are available today, and those are the endoscopic mid-face lifts, the ponytail lifts, and those are incisions that are hidden up in the hair that can allow brow position elevation, mid-face cheek elevation, and true neck contouring, all through incisions that are hidden back behind the ear and up in the hairline. This is an amazing innovation and really represents the pinnacle of advancements in facelift surgery today. So when you're looking for a practitioner who has the expertise to give you this fast recovery, ask whether or not you're a candidate for some of these minimally invasive techniques. They're phenomenal for younger patients as well as patients who don't have nearly as much loose skin. Once we are looking at situations where we have significant loose skin, where we need to be excising here, then the ponytail option is really moved off the table and not optioned any further. But you can still have an incredibly fast recovery, and we have incredible options for hiding and disguising the incisions. Oftentimes we try and hide them right at the edge of the sideburns. We really try to minimize and avoid, if at all possible, continuing up along the sideburns, because those can be scars that can be very, very difficult to hide. But incisions underneath the sideburns, along the ear and back in the postauricular region are very easily hidden. Small incision up underneath the chin is virtually impossible to see. And really, getting down into the neck and addressing that submandibular gland is extremely important if you're looking to achieve that beautiful sculpted jawline. We really need to be able to get into the neck and address that loose tissue, excess adipose tissue, address and evaluate the submandibular gland. If it's sticking below the angle of the mandible, then I'm going to need to have real conversations with the patients about whether or not they want that portion of the gland shaved off that's extending down below the angle of the mandible. In the patients who are comfortable with that, we're able to achieve incredible sculpting of that cervical mental angle and that goineal angle. But again, that's a patient-surgeon conversation to make sure that they're comfortable with it. I also have incredible innovations that I've recently published about the hyoid bone to mastoid neoligament that really is phenomenal for, again, adding structural support to this area to give spectacular jawline results. So I hope you found this helpful as we explore the differences and opportunities that are available to the surgeon community as we help patients achieve these optimal aesthetic results. Thanks so much.